Now I'm recording our lesson. Our lesson's topic is children's pharmaceutical dosage form. In our previous lesson, we talk about theoretical part of this topic. What means children's pharmaceutical dosage forms, requirements for these dosage forms. But today we will discuss preparation in examples of prescriptions for children's dosage forms. So let us remind what means children's dosage form. Children's dosage form a specific group of drugs that require special conditions of preparation, the strictest observance of asepsis, operational discipline, full responsibility for the preparation, quality control, and design to dispense drugs. Children's medicines, these are drugs that are allowed for use in pediatric practice in the relevant age child doses. The dosage forms that provide therapeutic benefits and convenience of currently. Requirements for children's medical forms. Which requirements? High efficiency and high therapeutic bioavailability. Sterility for newborns. Stability. No pyrogenic for babies, lack of allergic, no toxic, microbiological purity, easy of use, pleasant organoleptic properties such as color, taste, effect, smell, should provide a positive physiological effects on a child, kind of dosage form, color, taste, effect, smell. It is advisable not to use injections. Drugs which are allowed to take in pediatric practice shall not contain substances that affect the growth of development of tissues, lowers immunity, are toxic, do not contain preservatives and dyes. Dyes, it means color substances. For example, violet tetracycline tooth enamel in children. Affecting the growth of bones. Hiba joining. Good morning, Hiba. Tetracycline was enabled in children, affecting the growth of bones. Streptomycin and gentamicin can cause low toxicity. Prohibited medication containing alcohol for children under 1 year. Prohibited medication, sorry. So, when prescribing drugs to children should follow these guidelines. Assign only the intended dose of medicine according to age, body weight, conduct a preliminary test or tolerance and sensitivity to drugs intended for the mother, consider the functional state of vital organs of the body. Antibiotics and sulfonylamides set according to etiology, the Muhammad Al-Namri joining of microorganisms, not prescribe those drugs which often cause side effects, be desirable after preliminary test for allergies and sensitivity to appropriate groups A, B, research and possibly mother. Do not allow amplified drug therapy for benign disease. Medication use short courses. Do not use both drugs with the same mechanism of action. Paria joining. Features of prescription dosage form for children. Medications for children are issued on separate form prescriptions marked baby and point the exact age and weight of the child. Taking prescriptions should be checked and potent doses of toxic substances and the compatibility of a registered ingredient to consider the rationality of the combination of antibiotics, sulfonylamides, and other drugs. Doses of toxic and strong effective substances in suppositories compare with doses for oral acceptance. Carried out taking into account several factors which include pharmacokinetics and pharmacodynamics of drugs, child's age and weight, the nature and severity of disease, state of the liver, kidneys, heart, individual sensitivity of the child, household conditions of life, especially food, climatic and geographical factors, and medical anamnesis. To determine doses of drugs in pediatrics have long used by two methods. Empirical method, when your dose of the drug calculated for children of different age groups based on the effect which was observed from the drug in varied doses. And this method is based on the selection of doses that are determined by coefficient of special formulas. These formulas I gave you in previous lesson. Empirical, when the dose of medication to reduce children from adult doses according to age. It is not quite accurate as children the same age have different body weight, lodging, meals, etc. According to the method prescribed to children less than 1 year, from 1 to 24 months, and from 1 to 12 months of the adult dose. From 1 to 2 years, 1 divided to 12 of adult dose. From 2 to 4 years, 1 divided to 6 of adult dose. From 4 to 6 years, 1 divided to 4 of adult dose. From 6 years to 7 years, 1 divided to 3. From 7 years to 14 years, 1 divided to 2, half of adult dose, and from 14 to 18, 3 divided to 4 of adult dose. In this slide, you see some of types of these formulas, how we can calculate these doses. All dosage forms for children preparing for the general rules of preparation. Everyone hear me, my dears? My dear students,
Yes,
I want to hear you.
Yes, teacher.
Yes.
Okay. Although if anything is non-understandable, please ask your questions, okay? All dosage forms for children preparing for the general rules of preparation. Prerequisite for preparing medical substances for children under 1 year: sterility. Medicine for external and internal use, oil or aseptic manufacturing, ointments, suppositories, powders. All sterilization medication try to taste. Powders prepared for the general rules with subsequent sterilization in air sterilizer at temperature 180 degrees Celsius during 1 hour and store 15 days. Thermoliability substances added in aseptic conditions. All dosage forms for children preparing for the general rules of preparing. Prerequisite for drug forms for children under 1 year: sterility, medicine for external and internal use, or aseptic manufacturing, I repeated. All sterilization medications to try to taste, I repeat that in temperature 180 degrees Celsius. Mixtures prepared in accordance with the order, instructions for preparation of child dosage forms in pharmacies. Sterilizing at temperature 120 degrees Celsius, 8 minutes. Do not use preservatives and stabilizers. To improve taste and fruit syrups, lemon acid. Not allow packing more than 100 ml per prescription. Solutionis 0.02% dimidroli, packing no more than 10 ml. Solutions for external use the same as medicine. Oils for children, such as peach, olive, sunflower, petrolatum, in sterilized in the bottles for blood substitutes, temperature 180 degrees Celsius, during time 30 minutes. Most of these dosage forms are stored for 30 days. Now, commonly used in pediatric. Often used mixtures, suppositories, powders in pediatric practice. They are prepared by the general rules of preparation of medical forms for adults following aseptic condition. Dosage form for infants must be sterile. The technological process of preparing children's medicine for babies includes the following stages. First, preparation of aseptic conditions, preparations of dishes and accessories, preparation of solvents and drugs, quality control solutions, filtering solutions, checking the absence of mechanical inclusions. We can do it visually and by instrumental experience, closing, preparation for sterilization, marking, sterilization, and quality control and design of drafts for dispense. If you remember, medicine includes two substances, active pharmaceutical ingredients and excipients. Who can say what means excipients, my dears? Mustafa? Mustafa Alani.
Yes, teacher.
What means excipients?
Shut up, teacher.
Who can explain?
I don't know.
Teacher, this substance which give the color and smell.
And active ingredients, pharmaceutical ingredients, Hiba?
With the pharmacological effect.
At first in prescription we write excipients or active substances. Khalid. Khalid. Khalid, are you sleeping?
Yes, teacher, I'm with you.
In prescription we at first write active pharmaceutical ingredients or excipients.
What, teacher?
In prescription, at first, we write active substance, pharmaceutical ingredients, or excipients.
Active substance.
Which excipients do you know, Khalid? Okay.
I don't remember.
Okay. I continue. Types of dosage forms I want to repeat with you. Classified according to route of administration and physical form. Yes? Route of administration, if you remember, oral, topic, rectal, parenteral, vaginal, ophthalmic, otic, and others. Yes? Physical forms, solid, semi-solid, liquid, and gas form. Solid forms. Ali, what includes solid forms?
Yes, teacher.
Solid forms. Which forms include solid forms? Who can say? Which solid forms do you know, my dears? Don't you know about solid drug forms? My dears, do you hear me?
Yes, teacher.
Yes, teacher.
Solid drug forms. Tablets, powders, dusting powders, yes? Semi-solid,
Yes.
I repeat. Cream, pus, gel, suppositories, liquid, monophasic liquid, syrup, solution, biphasic liquids, emulsion, suspension, and gas forms, inhaler, and aerosols. Yes?
Yes, teacher.
Now, excipients. Which excipients we have in our pharmaceutical practice? Coloring agents, sweetening agents, flavoring agents, solubilizing agents, antioxidants, preservatives, thickening agents, suspending agents, binding agents, solvents, lubricants, and perfumes. These are types of excipients. In this slide, you see commonly used forms for pediatrics. And I want to quickly repeat with you some drug forms which commonly used in medical practice. For example, syrup. What is syrup? Syrup concentrated aqueous preparation of 85% of sugar and sugar substitute with or without flavoring agents and medicinal substances, if you remember. In medical terminology, medicinal syrups are nearly saturated solutions of 85% of sugar in water in which medicinal substances or drugs are dissolved. Due to the inability of some children and elderly people to swallow solid dosage forms, it is fairly common today for a pharmacist to be asked to prepare an oral liquid dosage form of a medication available in the pharmacy. Types of syrups. There are two types of syrups: aromatic or adjuvant syrups and medicinal syrups. Who can say me how we prepare syrup simplex? Who can remind me how we prepare a syrupus simplex and for what we use a syrupus simplex? My dears.
Simplex, you mean sugar? Sugar.
How many sugar and how many water?
Sugar 19. Not 17 or.
Syrupus simplex contain how many percentage of saccharose? My dears. Iba, 69%. It means that we take how many? It means that we take 64 gram of saccharose and 36 water, because concentrate of syrupus simplex is 64%. Okay?
You can again repeat. 96.
64 gram. 64 gram saccharose and 36 gram of water, because percentage concentration of syrupus simplex is 64%. In our next slides, I will give you the making process of saccharose of syrup simplex. Okay?
I write it, but I forget.
I know that you write it. Paria, can you say what means adjuvants, Paria? Paria. Ziyaddin. Who now hear and listen me? Hiba.
Yes, teacher. I will do.
Yes, teacher.
Yes, teacher.
Okay.
Yes, teacher.
Thank you for everyone who now hear and listen me. Okay. Amir, can you say me what
Yes,
means
teacher.
adjuvants in prescription?
What, teacher? I can't hear you.
Adjuvants. What means adjuvants? Helper substance. Okay, my dears. Adjuvants are helper substances. Okay, I continue. Medicinal syrups. There are two types, made from extractive drugs and made from chemicals. Component of syrup. What include syrups? Syrups include sweetening agent, antimicrobial agent, viscosity modifier, flavorants, and colorants. Many types of syrups, especially those prepared commercially, contain special solvents, solubilizing agent, thickeners, or stabilizers. There are manufacturing syrups. Preparation or stages of preparation of syrup, I want to quickly remind for you: solid ingredients, liquid ingredients, dosing system, production tanks, filtration, storage tanks, and filling machines. There are four methods of adding of solid drug substances to the solution: solution with heat, so agitation without heat, addition of sucrose to liquid medicament, and percolation method. In this slide, you see how stages of solution with heat, in next slide, agitation without heat. I will send you this material, and for this I talk about these steps quickly because I want to stop in the preparation of our prescriptions. Percolation method and formulations for some syrups. Oral liquid packaging. Now I want to remind you about pills too. Pills commonly used in pediatrics too, a dosage form in the form of balls weighing from 0.1 gram to 0.5 gram prepared from a homogeneous plastic mass. Pills weighing more than 0.5 gram are called boluses or BOP. The medicinal substances that make up the pills are thoroughly mixed. If the pills contain poisonous or potent substances, then they are pre-dissolved in water, alcohol, or an appropriate solvent. Insoluble substances are thoroughly triturated into fine powder with sugar or used in the form of pre-prepared triturations. These are instruments for preparing pills. As auxiliary substances for the preparation of the pills, the mass can be used water, alcohol, glycerin, sugar syrup, honey extracts, commonly liquorized fruit, wormwood, dandelion, starch, dextrin, sugar, apricot and gum arabic, white clay, bentonite, etc. From medicines with oxidizing properties, silver nitrate, potassium permanganate, a mass is prepared with the addition of inorganic auxiliary substances, kaolin or bentonite. Liquids not miscible with water must be prepared emulsified with liquorice extract, root extract, or apricot gum. The pill mass should be a homogeneous plastic mass easily behind the walls of the mortar and pestle. Ready-made pills are sprinkled with lycopodium powder or starch and pills with oxidizing agents, white clay. The pills can be coated with sugar or substances protecting the pills from the action of gastric juice. Pills should have a irregular spherical shape, not changing during storage. The surface of the pills should be dry and smooth. In a cut, the pills should be uniform. Fluctuations in the weight of individual pills should not exceed not more and not less 5%. Determination of disintegration. 1-2 pills are placed in a conical flask with a capacity of 100 ml and carry out of the determination as indicated in the article tablet from Pharmacopoeia. Disintegration of pills no more than 1 hour. Packaging pills are dispensed in boxes or jars. The prescription and signature indicate the weight of the pill mass. And storage, they must be stored in a cool and dry place. Commonly used for preparing of children's dosage form, olea pingva, fatty oils. Fatty oils are mixtures of glycerides or various high molecular weight fatty acids. Fatty oils are obtained by pressing from seeds and fruits. For the preparation of injection solutions, oils obtained by cold pressing from fresh seeds and are used. Description: transparent, usually more or less colored, odorless, or only oily liquids with a faint characteristic odor. Solubility of these fatty oils: it is particularly insoluble in water, slightly soluble in alcohol, easily in ether, chloroform, petroleum ether. The exceptions is castor oil, which is readily soluble in alcohol and difficult in petroleum ether. In the study of fatty oils, determine the color, smell, taste, solubility, and numerical indications. In the study of fatty oils, determine the color, smell, taste, solubility, and numerical indicators. I repeat. Soaps. For what we use soaps in our pharmaceutical practice? Soaps we use for preparing children's dosage forms too. In fatty oils, they used for the preparation of injection solutions, almond or peach oil. The definition of soaps is as follows. 5 ml of oil is burned in a porcelain crucible and calcined. The balance should not exceed 0.01%. 1 ml of pressure boiled water is added to the residue dissolved with light heating, and 2 drops of phenolphthalein solution are added. The liquid should not stain, or the slightly pink color that appears should disappear quickly, which indicates the soap content in the oil is not more than 0.001%. Who can say what means 0.001? This is gram, decigram, centigram, milligram. Who can say? When there
Centigram.
are 3 zeros, yes.
Centigram.
My dears, how we write 1 gram in prescriptions?
0.05. 1.0, yes.
Mustafa?
Yes, teacher.
Only 0.1. Yes? Only 1 zero.
Yes, 10.
1 0. And how we write decigram? Sorry. We said that gram we write 0.1. Sorry, 1.0. Yes?
1.0.
Yes, 1.0. And how we write decigram?
0.1.
Yes, correctly. And how we write centigram?
0.01.
Yes. And milligram?
0.001.
Yes, 3 zeros. And decimilligram?
4 zeros.
4 zeros, yes. After per zero, there are 3 zero and 1, yes? And
Yes.
centimilligram?
50.
Yes, after per zero, after point, there are 4 zero and 1 gram. And 1. And microgram?
60.
Yes. After per zero, there are 5 zeros.
Yes.
Now, dosage forms for children must be only harmless, must include only harmless excipients are used, mainly natural products. Their number should be reasonable to ensure the optimal therapeutic effect and stability of the drugs. For coloring, natural dyes that are harmless in medical practice should be used. Corrective substance should give the medicine a pleasant light, taste and smell and not reduce its activity and stability. Favoring agents should give the medicine a pleasant taste, smell and color, mix well with the medicine, not reduce its activity, stability and be indifferent or useful in the body substances, be stable in a certain pH range, resistant to light, oxidation and recovery. The volume of fluid containing the medicine should not be too large, 2.5 10 milli. That is a sufficient amount for a minimum course for the treatment. When developing tablets or dredges for children, one should strive for the smallest size from 3 to 4 millimeter in diameter and below, and be convex form, and of course prolonged action. Sanitary requirements in the manufacture of children's dosage forms. Manufacturing drugs under aseptic conditions. In aseptic boxing, eye drops, children's dosage forms, and intra-pharmacy blank are made. Medicinal substances necessary for the preparation of medicines under aseptic conditions are stored in barrels in tightly closed cabinets. Barrels are washed and sterilized before each filling. Auxiliary material is prepared, sterilized, and stored in closed bottoms for no more than 3 days. Auxiliary material and closures used in the manufacture and packaging of medicines are prepared. Sorry. Which flavoring agents we use? Previously, these are sucrose and sorbitol. Currently, fructose, maltose, invert sugar, citric acid, glycerin, sucrose, balsam, saccharin, sorbitol, and others. Sweeteners: sodium alginate, agar, agaroid, pectins. Preservatives: ethyl alcohol from 0.75 to 20%, benzoic acid, and sodium benzoate, etc. And which colorants we use? Amaranthus, tartrazine, carmine, saffron, indigo, carotene, pigments of resinous substances, and others. Now, our first prescription for preparing, inshallah, I think that in our laboratory we will prepare this prescription, okay? Soluciones acide borite 2%, 120 milli for rinsing. At first, my dears, we must calculate the amounts of our ingredients, yes? If you remember. My
Yes,
dears,
teacher. Yes,
How
teacher,
we-
we are here.
how we calculate the amount of boric acid? What means 2%? If we have 120 milli solution, how many we must take acidum boricum if they are prescribed 2%, my dears? What means percentage? Mustafa, every time
Like
you
teacher,
write
we
in our blackboard. Now commonly you must ask to my questions.
Like you mean we take the percentage from the all amount, the whole amount, the
How
one
many?
120?
Yes, for 120 milli, how many we must take
12.
acidum boricum if they are prescribed 2%?
12?
Mustafa,
Eh,
what means 2%, my dears?
2% from the 120.
Yes, every
Like,
100 milli contain 2 gram. Yes,
Like it's 304?
if our total solution, total volume 120 milli, how we calculate? If 100 contain 2
We divide
grams,
it on the
at that
100.
time
We divided it
120
on the
milli
100.
contain 2.4 gram.
Yes, teacher, we divide it on 100.
Yes, of course. In
Yes.
this prescription, boric acid less than 3%, and
Yeah.
for water we take 120 milli purified water. Passport we must label. Yes, we must draw passport. Passport means written control record. In passport
Yes,
we
teacher.
write acidum boricum 2.4 gram, aqua purificata, purified water, 120 milli. So total volume of our prescription is 120 milli. Yes.
Yes.
And preparation steps. Stage of preparation. At first, we select a dispensing bottle with a stopper, a stand for the preparation of the solution, a funnel with the cotton swab, a cylinder for measuring hot water. Because acidum boricum is dissolved in the hot water, not cold water. Prepare a cotton swab, rinse it twice in the stand, rinse it. A fresh portion of purified water is filtered and rinsed with a temperate bottle. Use a cylinder after rinsing it with hot water. Measure 120 ml of hot water. Place in a stand and dissolve in hot water. Purification 2.4 boric acid with agitation. The resulting solution is filtered in a tempering bottle closed, checked for thin liners, and hermetically sealed. Stick the label external. In addition, keep in a cool place because aqua solution deteriorate quickly, and we must write recipe number. In label, we write the name of pharmacist and controller pharmacist, pharmacist who made this prescription, and name of pharmacist who control the making process. Yes. Write out and indicate. This is the formula, chemical formula of acidum boricum. In Russian, acidum boricum is kislota borная, and so manufacture our this is manufactured trade form of acidum boricum in so packaging form and in the bottle form. If the solvent is not specified, then take aqua purificata. We prepare aqua solutions in a weightless way. What means weightless way, my dears?
Teacher, can you repeat?
What means we prepared prescription in weightless way? Which forms of ways of preparing do you know? By weight and by? Now we preparing this prescription by weight form, by weight way. But we can prepare by alternative way. This is volume way, my dears. Volume way. Boric acid is hardly soluble in cold water. I said this. In cold water, proportion of its dissolving 1 to 25. And for this, we take hot water because in hot water, its proportion 1 to 3. Did I finish the time of Zoom? For this, we continue now, my dears.
Yes.
Now, our second prescription. Our second prescription is the recipe Rhizomatis cum radicibus valeriani. This is the sedative drug, you know. Herbe leonori, Foliorum farfare, Anna 20 gram, Corticis viburni 25 gram, Aqua purificate at 800 milli. Da signa by 1 tablespoon 3 times a day. How we prepare infusum and decoctum? We at our first semester learned to prepare all forms, all drug forms, and now we repeat these preparing steps, preparing stages, because in pediatric for children dosage forms we prepare from all these types of drug forms: powders, solutions, infusum, decoctum, and others. For this prescription, the decoctum of viburnum bark is prepared separately. For this, we must get 10 ml of extract from 1 gram bark. Since viburnum bark belongs to the general list, 25 we multiply to 10, and this is 25 milli. To get 25 milli of water extract, you need to take 250, sorry, plus 25 plus 25 and multiply to 2 milligram divide milli divide gram, and there are equal 300 milli of water. To obtain the infusion, you need to determine its volume. 800, for this we calculate, so 800 milli minus 250 equal 550 milli. Okay. And to do this, take 550 plus 8 multiplied to 2.2 and plus 20 multiplied to 2 and plus 20 multiplied to 3. This is equal 673 milli of water. If in one preheated infundirka, you know what means infundirka. This is instrument for preparing infusum. Its other name, alternative name is tunica. We put 25 crushed viburnum bark and 300 ml of room temperature water and put it in water bath for 30 minutes. Insist at room temperature for 10 minutes. After that, we filter into the cylinder. Squeeze it, if necessary, bring purified water to 250 milli. In another pre-warmed tonic or infundirka, we put 8 gram rhizomes with valerian roots and 20 motherwort grass and 20 leaves of coltsfoot, and per 673 ml of purified room temperature water. We insist on a water bath for 15 minutes at room temperature for 45 minutes. For 45 minutes. After that, we filter it into a cylinder, squeeze it, and if necessary, bring purified water to 550 ml. And how we write working recipe or passport for this prescription? Rhizomatis culvum radicibus valeriani 8 gram, herba leonori 20 gram. Why, Mohammed? Why we take? Why we write in our passport herba leonori 20 gram too? In our prescription, there are no written how many after herba leonori, but we take so 20 gram. Why? According to prescription. Who can say me? Mohammed Al Namri. I ask you.
Yes, teacher.
Why we take 20?
I don't.
Why we take Mustaba? I'm glad to see you here. Why we take herba leonori 20 gram?
I don't know, teacher.
Please look at the prescription. There after folium farfare written Ana. What means Ana?
Equal.
Same.
Same.
Same. Herba leonori folium farfare Ana 20 gram. It means that we must take 20 gram herba leonori and 20 gram folium farfare. It means same. Same. It means that 20 gram we adapted to herba leonori 2, okay, and cortices we burn 25 gram, and so we write in our passport, and aquae purificate at 800 ml. But we in our calculation calculate how many water we must take for preparation of this solution. In result, we calculate that we must take 673 ml of water and add after until 800 ml. Understandable this prescription?
Yes, teacher.
For understand this prescription, you must repeat how we prepare infusum, my dears. Our next prescription for children's dosage form: infuse herba leonori 200 ml, analgine 5 gram, kalium bromide, natrium bromide 4 gram, and tincturi valeriani 6 ml, mistida signa by 1 tablespoon 3 times a day. For preparing this prescription, at first, what we must calculate, my dears? Mustafa, Mustafa Alani, every time you calculate this, how we starting to calculate? From what we start to calculate?
From the main ingredients?
Yes. No. If we speak about solution, we must calculate what? We
The
know
main ingredients.
the volume of 1 tablespoon. How many? Look to my desktop. Look to my desktop. For calculation, I must calculate the total volume of this prescription. For that, what I doing? I add to 200 ml the volume of tincture valeriani, 6 ml.
Yes.
In result, we have total volume how many? 206 ml. Yes, my dear. 206 ml. After second step in calculating, we must divide our total volume to the volume of 1 tablespoon. Yes, my dear. And we know that volume of our tablespoon is 15. Yes. For this, we divide 206 to 15 and we calculate 13. What means 13 in this time? But this result 13, it means the using amount, using time. How many times we use this solution? Only 13 times we can use this prescription. Yes, because our volume give us only this advantage. We can use only 13 times because total volume of our prescription is 206 ml. After, we must check dose of analginum because analgin is from list B. Pharmacopoeia gives us that its highest single dose is 1 and highest daily dose is 3. In our prescription, analginum 5. It means that its single dose, for calculating of its single dose, what we must doing? You must divide his total dose in our prescription to the using time. 5 divided to 13, 0.38. 0.38 shows us the single dose of analginum in our prescription. Yes, my dears?
Yes,
Iba?
teacher.
Yes, teacher, yes.
Mustafa, do you understand?
You can say that.
Mustafa, at first we calculate the using time, the amount or number of using time of our old prescription. After, we must check the dose of analginum. For this, we divide its dose to the number of our using time, and we calculate that single dose of analginum in our prescription 0.38. After we sorry, this is mistake in my slide.
Teacher, 5 from where we take it? 5.
5 what?
5 analgin.
5
From where?
gram? It is written in our prescription, analgin 5 gram. Can you see? Please, this is our prescription, and there is analgin 5 gram. If you see,
Okay.
yes, and pharmacopoeia says that single dose, highest single dose of analginum is 1, and highest daily dose of analginum is 3. For this, we must check its dose for our prescription. Correctly written this prescription by doctor or not? If we know that its highest single dose 1 in this prescription, dose of analginum cannot be more than 1 gram. And we calculate and we say that its single dose, according to our prescription, is 0.38. It means that doctor wrote this prescription correctly. Correct.
Teacher, this 0.38 for 1 spoon, single spoon?
Yes. In 1 tablespoon, every time, for 1 using time, we use only 0.38 dose of analginum. But totally
30 time. Yes.
But totally in the day, we use 1.14 gram analginum because we must multiply 0.38 to 3 because signature say us by 1 tablespoon 3 times a day. If they are written 4 times a day, we must multiply to 4.
Multiply. Okay.
But every time when we speak about infusum, who is coming? Who want to admit it? Nobody. All my students from 817 1A, only Paria from 1-3. I3. Paria, you are from I3.
I3 too.
Yes, teacher, yes,
All
teacher.
other my students from I1. Yes, my dears.
No,
teacher.
no, teacher.
Teacher,
How
memory
many
and Mohammed
students
Ahmed.
from I1 and
I3.
how many students from I3? Say me, please.
آية
Teacher,
3
no.
محمد أحمد
I1.
محمد نمري محمد محسن باريا.
Teacher 7 from the I1.
7 from I1.
Four.
And how many
Four.
from I3?
4% from I3.
How many?
4.
4. Okay. Okay, my dears, we continue. In this prescription, you must calculate dry matter. What means dry matter? We take herbs in Leonore, herbs valeriana, and for this we must calculate the percentage of dry matter too. How we calculate the percentage dry matter? We learned as the first semester when we learn how to make infusion in the coffee. This is tasks for you because I don't want to stop in this prescription so many times to repeat how we calculate dry matter. Okay, my dears. And according to dry matter and water absorption coefficient, we calculate the volume, total volume of water which we must take for preparing this preparation, this prescription. Technology, stages of technology. First step, put infundiary apparatus, I said that it's alternative name tunic, on a water bath, warm up for 15 minutes. Chop the motherwort grass to 7 millimeter, put it in the tunic and fill in the 234 ml of purified room temperature water. Put in a water bath for 15 minutes, then we insist at room temperature for 45 minutes with periodic stirring. Filter into the stand through a double layer of gauze and squeeze. Weigh out 5 gram analgin, dissolve it. Weigh 4 gram potassium bromide, dissolve, because in our prescription written analginum, kalium bromidum, and natrium bromidum.
Teacher,
Yes.
Ali wants your permission to enter the meeting. Can you give him the permission?
Please repeat. I hear very slowly.
Ali from the group I1. He's waiting the permission from you to
Okay,
enter
I
the
admit.
meeting.
I admit. Thank you.
Okay.
I admit him. Okay. And after we weigh 4 gram potassium bromide, dissolve. After we weigh 4 gram sodium bromide and dissolve it, filter through a dry cotton swab into the cylinder, and if necessary, bring purified water to 200 ml through squeezed raw materials. Transfer to a bottle, dispensing bottle, add 6 ml of tincture of valerian, cork, and make out or labeling. And how we must labeling? Who can say how we must label this prescription? My dearest? Hasin?
Yes, teacher.
Hasin? How can we label this prescription for giving to patient? What we must
name of the drug?
Yes, what we must write there?
Name of the drugs.
But this prescription without name. In labeling, we write the signature by 1 tablespoon 3 times a day, time of preparing, making, the name of pharmacist who make, and the name of pharmacist who control the making process. Okay, my dear.
Yes, teacher.
Our next prescription about infusion 2, because for children we commonly use these forms, these dosage forms. Infusi, our prescription, infusi foliorum daturi stramoni x 2 gram to 200 ml by 1 dessert spoon 4 times a day. Mustafa, I every time remember only Mustafa when I speak about calculation and about writing of prescription, because every time Mustafa write in our blackboard for this. Mustafa, how we calculate the amount of hydrochloric acid? If you remember, for preparing this infusion, we must take hydrochloric acid, because in acid condition we can prepare this infusion. You must repeat. I know that you must repeat this time about preparing of infusion for this. In this slide, I give you, and I remember you how many hydrochloric acid we must take for this infusion and calculating of hydrochloric acid. I must remind you that proportion of hydrochloric acid is 1 to 10. Only not less and not more than 0.83%. And how we doing dose check? Datura leaves, we must check its dose, and we must check dose of alkaloids because Datura stramonium contain 25% of alkaloids. And it's required to take in result after calculating we see that it's required to take 0.005 of pure hydrogen fluoride for infusing condition from this raw material. Technology steps. Stage. At first, you must standard raw materials are used or calculated according to the formula X equal A multiply B divided to C. Please repeat this time because I gave this information for you. The second step, the pH of the extractor affects the extraction process. My dears, this is infundirka. This is tonic, where we prepare infusion. And a simple form of this infundirka is so. If you remember. The alkaloids salts in water are soluble, but the alkaloids base are not. To dissolve them, the extractor must be acidified. For this, is carried out 0.83% solution of hydrochloric acid. Acid by weight as much as contain alkaloids in their pure form is the taken medicinal plant material. I want to give you our next prescription, furacelinum. The trade name furacelinum, but its international name is nitrofural. Nitrofural, its chemical formula, and this is a trademark of furacelinum. From furacelinum powder, we prepare solutions for using not only for childs, but for adults too. Our prescription solutionis furacelinum 1 to 5,000, 250 milli. Who can say what means 1 to 5,000? Paria? Can you say me what means 1 to 5,000? Who can say me? Who hear me?
Yes, teacher.
Yes, teacher.
Mustafa.
1 part and 5,000.
1 part furacelinum, 5,000 parts water. Yes? Proportion 1 to 5,000. And for this, how we calculate the amount of furacelinum? If the solvent is not specifically indicated in the recipe, we must take 0.9% of sodium chloride. Solution is used which reduces the irritating effect of furaceline and facilitates its dissolution. For this, the amount of furacelinum, if 1 in 5,000, and how many in how we calculate the dosage of furacelinum? If we have this proportion, 1 in 5,000, at that time, how many must be in 250 milli? And so we calculate that it must be 0.05 gram furacelinum. And how we calculate the amount of sodium chloride? If 100 milli contains 0.9, because we know that isotonic solution contain how many sodium chloride? 0.9 gram. Yes? 0.9% of sodium chloride we name isotonic solution. And for 250 milli, you must take how many? 2.25. So the amount of the amount of water 200, total volume 250 milli. In passport we write working recipe, passport we write furoselenum 0.05 because we calculate that, so it must contain natrium chloride or isotonic solution 2.25 milli, aqua purificata 250 milli. So total volume is 250 milli. And technological process, at first we must pick up a dispensed bottle of orange glass because it's light sensitive, a funnel, a flask made of heat resistant glass, a cylinder, wash a cotton swab, rinse the dispensed bottle, flask and cylinder, 250 milli of purified water. Purified water measured in a flask and sorry, Mustafa Al-Rikabi coming, joining. Good morning, Mustafa. We continue. 2.25 gram sodium chloride is dissolved in it. 0.05 furoselene is placed. Furoselene is weighed according to the rule of working with dyes. After complete cooling, the solution is filtered. The volume is adjusted to 250 milli. Place in an orange glass dispenser. Check in the clean liner, seal visually. Stick the label external. Keep in a cool place. Keep in a dark place. And write out of working recipe. It is understandable for you. We will prepare this furoselene solution in our laboratory, inshallah.
Yes, teacher.
Now, our next prescription, cupri sulfatis, which is commonly used in pediatric practice too. Solutionis cupri sulfatis, 10%, 200 milli for dashing. This is our cuprum sulfatum. This is its solution. This is crystals of cuprum sulfatum, and this is chemical formula. At first, we must calculate the amount of every ingredient, and after write working recipe. How we calculate amount of cuprum sulfatis? If they are 10%, it means how many we must take for 200 milli, my dears? Mustafa, Mushtaba? In our prescription written 10% cuprum sulfatum. For 200 milli, how many we must take, my dears?
20 or 2?
Yes. Because if every 100 milli contain 10 gram, it means that 200 milli will contain 20 gram of cuprum sulfatus. Yes? And purified water add to 200 milli. Copper sulfate is crystalline coloring matter readily soluble in water, 1 to 3% proportion, but due to wettability, the reaction is very slow. And technological process, what we must doing, at first select a dispensing bottle, a funnel with a filter, a cylinder, a mortar and pestle. We take from 150 to 170 milli purified water and measured in a stand, 20 gram of copper sulfate titrated in dry form by adding 10 milli of purified water, half according to the reagents rule. Who remember the reagents rule?
Well, because it's coloring substance,
The copper is colored substance. The sulfate.
The reagents rule. I want to remember the reagents rule. What means the reagents rule? In which forms we use the reagents rule? According to the reagents rule, we every time take half of solvent.
And we added the...
What? Hiba, continue, please. My dears, Hiba.
Other material,
Half according to the reagents rule, increasing the contact area with the solvent, we every time take only half of solvent. So in our situation, we add only 30 milli of purified water, triturated. The transparent solution is filtered into a graduated cylinder carefully so that an undissolved precipitate remains in the mortar. And after we again and again repeat this process, triturated again and filtered again, this operation is repeated until the substance has passed into solution. Yes? Do you remember this process?
yes, teacher.
Through this filter, rinsing the mortar and pestle, filter the remaining water into the cylinder to a volume of 200 milli. Transfer the solution to the dispensing bottle, close it, check the cleanliness, tightness of the closet, and stick the label external, keep in a cool place, and write out our worker recipe. So our next and most interesting prescription solution is argentin nitrates 0.2% to 150 milli, disigna by 1 tablespoon 3 times a day. What can we say about argentum nitrates? In which forms we use argentum nitrates? Do you know the pencil lapis, trade name lapis, which manufactured in our countries, post-Soviet countries, post-Soviet Union countries? In Iraq, in Iran, do you know so in your pharmacies? Lapis. I forget name of disease in English, sorry, I want to see. In Azerbaijan language, zil, in Russian, baradavka. I don't know, I forgot about it in English. 1 minute, please. Word, my dears, from word.
Word.
Do you know lapis pencil, which contain argentum nitrates? Nobody? Silver nitrate. Transparent crystals are easily soluble in water. It gets dark under the influence of light. Used as an antiseptic, cauterizing solutions, and according to its cauterizing effect, it used for wort. Solutions in concentrations above 2% are released only into the hands of a doctor. This substance from list A. According to this prescription, you must calculate the verification dosages amount of argentum NO3. We calculate this. This solution contains 0.3 gram of argentum nitrates. It's single dose. We calculate. How we calculate? We divide the dose of silver nitrate to the 15. Why to 15? My dear students.
Yes, we divide 0.2.
What means 0.3? It's the amount of silver nitrate, because 0.2% in 150 milli, you calculate that this is 0.3. Because if 100 milli contains 0.2, 150 contains 0.3. And for calculating of single dose, you must divide this 0.3 to 15 milli, because 1 tablespoon contain 15 milli water. Yes? And yeah. So we calculate that it's single dose. Oh, sorry. That it's single dose 0.03 and daily dose 0.09, because we must use 3 times a day. And according to pharmacopoeia, we can say that its dose are not overstated. Okay, now technological process, worker recipe, how we write worker recipe, Argentine nitrate 0.3 and active purificate 150 milli. So total volume of our prescription is 150 milli. Technological process, at first pick up a stand dispensing bottle of orange glass, wash and swap with freshly distilled purified water with the stand up and the dispensing bottle. In a stand measure freshly boiled purified water, filter it in a dispensing bottle, draw up a recipe for obtaining from a pharmacist technologies 0.3 silver nitrate, get it. Check the purity of the solution. If necessary, filter through a cotton swab washed with hot water, cork. Stick the label internal, keep in a cool place, dark place. The cork is tied with a cap, sealed. Write out the signature, worker recipe. They are kept under lock and key until give medicine to the patient. Because have very strong cauterizing effect.
This for what disease?
For what disease? Argentum nitritis using externally for warts, I say for dashing, vaginal dashing in gynecological practice, but in pediatric practice, it commonly used as anti-inflammatory from some gastric disease, gastrointestinal tract disease. Okay. Now, eophilinum, our next prescription. Who listen me, my dears? From students, who listen me? Who hear me?
Teacher.
Everyone, okay.
Yes.
We continue. Eophilinum, saccharum, miscefiat pullis. Eophiline is 0.003 gram. What means 0.003 gram? I must say this is centigram, milligram, decigram. Eophilinum, how many? Correctly, I must say how many?
Milligram?
Yes, milligram. Just now we said. If there are 3 zeros, eophiline 3 milligram and saccharine, I must say 2 decigram. Eophiline 3 milligram and saccharine 2 decigram. Miscefiat pulvis, datalis doses number 20. Signa by 1 powder 3 times a day for 6 months baby. And our calculations, at first we must dose check eophilinum according to the weight of children and according to the pharmacopoeia we must check, and in result we can say that doses are not overstated. I don't want to repeat how we check those because in our previous slides we talk about this. Calculations, mass of eophilinum. How many eophilinum we must take, my dears? Ziyaddin. Ziyaddin. Mushtaba.
Yes, teacher, yes.
According to this prescription, how many eophilinum you must take? There are written 3 milligram eophilinum, but you must take datalis doses number 20. As a result, how many we must take? You must multiply. We must multiply 0.003 to 20, and as a result, we must take 0.06 gram of eophilinum. And sucrose, you must take, so 0.2 multiplied to 20, because 20 part you must take, and 4 gram. Total mass of our powder is 4.06. Technology process, making